This is the Amazon basin. Tens of thousands of rivers wind their way across this fertile landscape. Each one eventually joins the Amazon River in its long journey to the Atlantic Ocean. In Brazil, this branch of the Amazon creates a maze of islands and narrow channels of water through the rainforest as it rises with the annual floods. Navigating this aquatic labyrinth is second nature for the many who call this region home. The people here live in isolated communities of 5 to 20 families, much as they have for generations. They lead simple lives, relying on fishing and gardening to survive. Each year, the depth of the Amazon in this area fluctuates by as much as 60 feet. The flooding creates serious health and sanitation problems for the many villages dotting the banks. The lack of toilets to contain waste means an increased risk of disease when the river rises. But all that has changed at this village, where ADRA recently installed toilets in each family's home.
Porque nem todos tinham, né? Banheiro, às vezes tinha e muitos ia só para local, né? E aí, assim não. A pessoa de dentro de casa mesmo vai lá no banheiro, né?
The health needs in these remote communities go far beyond sanitation. This village is so isolated that it takes 8 hours by boat to travel to the nearest hospital for care. For others, it is even worse. Maria Lucia from a village farther upstream says it takes her 27 hours by canoe to reach Monica, Peru, the nearest town with medical services.
É porque para nós fica difícil, porque vamos para Manacapuru no final do mês, a gente só passa 3 dias lá, que vai comprar as coisinhas e volta, né? Pra gente ir pra médico, essas coisas, a gente, ó, é mês e mês e mês pra gente ir, a gente não tem condição de ir, né?
In an emergency situation, the long trip can mean the difference between life and death. To address this issue, ADRA, along with local partners, restarted a well-known medical missionary project known as Luzero, or Lightbearer in Portuguese. Luzero began in 1931 when 2 missionaries, Leo and Jesse Hollowell, decided to build a medical missionary boat to reach isolated communities along the Amazon. They called that first boat the Luzero. These Seventh-day Adventist pioneers spent 30 years traveling up and down the Amazon River, bringing love and medical care to isolated communities. Now, ADRA's new Luzero program uses a small fleet of powerful motorboats to deliver medical care and emergency transportation services to the region. Thanks to the Luzero program, an ADRA-sponsored nurse is stationed near this village to provide immediate care.
A piranha mordeu meu dedo, eu fui lá levar para ela, ela fez curativo bem umas 2 vezes. Deu carão ainda porque eu não fui logo, né, no mesmo dia, né? Que aí ela costurava, né? E aí pegou, barcou daqui, ó. Tudinho aqui, ó.
The nurse travels up and down the river, providing basic health evaluations, dealing with common ailments like diarrhea, and treating injuries. Maria Lucia even received her first dental cleaning recently.
Eu achei bem, graças a Deus, né? Para nós é bom demais, porque essa distância que a gente mora, né?
Thanks to the Luzero boats, ADRA is bringing the light of God's love to the Amazon through this vital medical work.
Eu gostaria de falar para eles que foi muito bom de fazer esse banheiro, né? Que ninguém tinha, e mandar essa enfermeira para ir, né? Que é muito bom ela estar aí também. E agradecer eles por causa disso, né? E para cá tá, que nem ela tá aí, né? Tá muito bom para nós. A pessoa precisa de um remédio, vai lá com ela, tem, né? De agradecer eles por causa disso.
In the Amazon rainforest of Brazil and around the world, ADRA is changing lives by addressing the basic needs of people. Join us as we show the world the simplest expression of God's nature, His love.